was double booked. So what that means is they put two patients in the same spot, but we're booked for 15 minutes. So that means if you do math, that's 7 minutes a patient.
Right.
And she had breast cancer. But I walk into this room and I have 7 minutes to ask her what she wants to do. Would you like your left boob, your right boob, both boobs removed? You want lymph nodes gone? Like, well, I got a 7-minute consultation and you have all these options.
There's this almost unwritten thing in medicine that doctors don't talk about, but it's there. And it's this concept of we made a lot of sacrifice. We spent a lot of money. We studied a lot of years. And you kind of get to a point when you go down that rabbit hole of starting to become a doctor, and it takes a long time, sometimes up to 10 years, where it's like, there's no turning back at this point. I'm way too heavily invested. I've spent too much time, too much money, too many sleepless nights, too many sacrifices.
Right.
And then they become a doctor. And
Congratulations.
yeah. And it wasn't all they thought it was going to be. They get exposed to a dark side, which they kind of knew about, but didn't really know about it. They see that now the companies they work for are kind of treating them like gold diggers and are milking them dry. And they're seeing a bunch of patients, and they realize that when they're on call, they're not really getting REM sleep. And so they're bugged out half the time. And they're seeing things that they were not quite prepared for, that people dying in their arms, so on and so forth. They are overworked. They are stressed out. They also found a new level of corruption in the industry that they were not necessarily exposed to behind the textbook. Now they're in this world, and most doctors are like, well, it is what it is. There's no hope. I just got to live through this nightmare that I found.
Right.
But then here you are, and you've survived it, and you've been that doctor in that chaotic state, and then you found the light at the end of the tunnel. You dramatically turned your life around. You're actually making more money and working a lot less.
Yes.
And you found a method, and now your mission is like to go out there in true medical fashion, true holistic medical fashion, to go out there and save.
Oh yeah, save my colleagues.
All your colleagues say, hey, I found a better way. Here's how you do it.
Yeah.
Does that sound about right?
Oh, I mean, honestly, that's beautiful for somebody who hasn't lived in as a doctor. I feel like you have one in your family, or you're married to one, or you have somebody that has lived this. Yeah, I think you spend, you're looking at kids. They get out of school, right? They think they're doing all of the greatest things. They go 4 years of college, med school, then they suffer through residency. By the time they get to a place where they get this validation for all of their hard work, right? It's a good paying job. They're going to pay back some of their student loans. And so they made it. And then they get there and the hours are ridiculous. For the first couple years, you're like learning with your colleagues. So you're inspired and you sort of like get indoctrinated and brainwashed into this system.
Yeah.
And I'd say burnout happens a few years later. You don't even notice it. And because you spent so much time and investment in your education, thinking that the people that are educating you are like their word is gold.
Yeah.
So when science and data moves at the speed that it does, you have to basically undoctrine yourself from what you have learned.
Yeah.
And then, you've been told that all these people were right all the time. So now you're living in a system that pushes an algorithm, which you were forced to memorize day, sleep, night. I mean, we had ways to memorize tons of medical structure and then just deliver it on a conveyor belt to people.
Yeah.
And then now the conveyor belt moves really, really fast. Reminds me of that I Love Lucy scene where they're like pumping the chocolate in.
Yeah. You're not just like a GP. I mean, you're a rather accomplished doctor in you've got quite a vivid background. I mean, can you get into a little bit of the kind of medicine that you've practiced?
Yeah. So it's just important to distinguish that I'm a physician assistant. So my route to being a provider is different than that of an MD or a DO. So it's just an important distinguishment. I'm fortunately not an MD or DO because as a physician assistant, I'm actually allowed to change fields, whereas doctors sort of get really locked into their field. So if you want to feel locked into your field, now you're talking about doctors that are stuck in a field. Physician assistants, nurse practitioners, we can actually change medical professions pretty easy because of the way that our careers are designed to work in collaboration with somebody.
Okay.
So it's kind of a benefit. It has its perks. But yeah, no, I did 6 years in general vascular surgery with honestly the most amazing surgeon I've ever worked with. There's few people that are double board certified in general surgery and vascular surgery. And as his right-hand man, so to speak, he taught me a lot about medicine. And he actually is probably the reason that I was so highly revered amongst my colleagues.
Yeah.
So I have to thank him for that. So the traditional system has its training perks for sure. Worked my way into emergency medicine. COVID actually switched that around for me. Elective surgeries got shut down and they needed more people in the emergency room. So that's how I ended up, doing a little bit more emergency medicine. Um, Back and forth between the two fields, I probably put in anywhere between 60 and 80 hours a week, missing tons of time with my family,
Yeah.
massive burnout, and a little bit of pigheadedness, if I'm going to say anything, right? Like you were the person they needed, right? So there was a little bit of glorification with the status.
Yes.
And I think that if we're all going to be humble for a minute, when you become a provider in a specialized field, to be the person that people need is kind of validating.
Yes.
But to be the person people need 80 hours a week is not ever what you're
Right.
striving for.
Yeah. Was there a point, can you pinpoint a moment during your career where like, dude, I'm sorry, I'm not doing this anymore?
Oh yeah. I mean, there was a few. They sort of compound, and I think the more you try to remember those incidents, the more come up, and you're like, oh yeah, that was hard. That was a hard day too, and they start coming. But I think the very last straw was I'd already been a little burnt out. I don't think was performing at my best in a sense of a HR perspective, right? Things that were coming up in the traditional system, I was complaining about, and I felt like my complaints on the traditional system, overcharging patients, overbooking, were falling on deaf ears.
Yeah.
And so I was a little riled up. And the day that I came to clinic, that was really like I went home and just signed my resignation letter that I had sitting on my computer for a month. I had gone into a patient's room, and I worked in surgery at this point, and I was double booked. So what that means is they put two patients in the same spot, but we're booked for 15 minutes. So that means if you do math, that's 7 minutes a patient.
Right.
And she had breast cancer.
Right.
And I was used to walking in to somebody who already knew their diagnosis.
Yes, yes.
And my job was just to tell them the surgical choices that they could have. But I walk into this room, who's a lady sitting by herself. She has no support with her, which is odd. Usually when they come into a surgical consultation, they have a spouse, sister, brother, friend, somebody.
Yeah.
And so that kind of already like, and as I'm talking to her about her surgical options, she just is staring at me like she has no idea what I'm talking about. And then I thought I made a mistake. I was like, oh my gosh, I better go double check my chart, right? Like I thought the error was on my part. I'm like, oh my gosh, this lady's probably here for a she's probably here for a gallbladder, and I walked into the wrong room, right? So I walk out and I check the chart, and I come back into the room and compose myself again, and she has no idea she has breast cancer.
Oh, God.
And somehow she got from primary care to her breast biopsy to my seat in a surgical consultation, past oncology's, consultation, past all of this to my office, and I have 7 minutes to ask her what she wants to do. I mean, and not to be grotesque, but it's like, would you like your left boob, your right boob, both boobs removed? You want lymph nodes gone? Like, I got a 7-minute consultation and you have all these options.
You have to be out of there in 7 minutes.
I mean, to stay on time for clinic, that would have been what was expected of me. But needless to say, that there's no way that goes. That doesn't happen in a 7-minute consultation.
Yeah.
So now I was probably behind in the first place, right? As doctors are usually running 30 minutes behind. So let's say I'm 30 minutes behind, but now I'm an hour and 15 minutes behind.
Yeah.
And patients are complaining, my MAs are getting yelled at, well, I walk out of the room just livid, and I may or may not have, misdirected my anger to the staff members. And I'm like, oh, this is going to be an HR visit for sure. Which at this point, I'm frequent flyer there because I had so many complaints that I was just feeling unvalidated. And then, I'm like, okay, get back to work, figure it out, catch up. The next patient that I go see, I'd been working with them for their surgical consult for a month or two. They're getting a CT and they're going to go get surgery. And I go in and I talk to them like, great, we got your CT back. Let's plan your surgery. And he goes, oh, I can't do it. And I was like, what happened?
What do you mean?
And he goes, the CT is $6,000. Okay, if you're not familiar with imaging, a CT should never cost $6,000.
Right.
I mean, it's about a $300 cash pay.
Right.
It's nothing special. It's a CT. It's not an MRI. It's not
It's a picture.
It's a picture. And I'm like, oh, that's ridiculous. What what's happening?
Yeah.
And he goes, well, I haven't met my deductible. My insurance says I have to pay, blah, 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 blah. I was like, there's no way to give him a cash pay price.
Yeah.
I could go in without insurance and say,
Yeah.
hey, can I pay for this? And,
Yeah.
and the price was going to be $300.
Wow.
And I was like, wait, none of this makes sense.
You just saw kind of how corrupt it is.
I did. And I just felt like there's no way that I can keep selling this. Like that's basically what I am. I'm the front runner salesperson for traditional healthcare.
Yeah.
And I was like, none of this works
Yeah.
if I choose not to participate anymore.
So the system, a lot of corruption, too many hours, not super ethical, money's not really there. You found a much better way. What is that better way?
So I stepped into something called direct primary care.
Direct primary care.
Okay. It's a legal term. It's similar to concierge medicine.
Okay.
Okay. Everyone seems to kind of be a little bit more familiar with what that means, where they have a direct relationship with their provider. And that's really where the term comes from.
And that sounds like the way it should be.
Yeah. Right. There's two important people in medicine, the person that needs the help and the person that knows what to do to give the help. That's really all there should be.
That's fun.
So direct primary care is based on membership models. So people pay a flat rate membership fee for the service that they have with their provider. And there's different ranges depending on who owns the practice.
Okay.
I would say they range anywhere from $50 to, gosh, if you're locationally in a place, you could be $350 a year, but $100 to $150 a month is about what you pay. And it depends what services you provide. So for mine's $150 a month, and you have unlimited access to primary care.
Yeah, I mean, my God.
So for under $2,000 a year, you can pay for your health care in a primary care setting.
Yeah.
And, for my practice, it's, normal business hours. It's not concierge. It's 8 to 5, Monday through Friday is what times, our clinic and staff is available.
Yeah.
We do have people that check messages after hours and things like that. But for the most part, you're not paying for concierge. You're paying for, monthly access to your provider, prescription refills, conversations, weight loss plans, hormone therapy. And because you're not confined by insurance's restraints, you're allowed to offer a holistic approach to somebody's healthcare. So I don't have to sit there and chart for 7 hours and make sure it's medically coded appropriately so your insurance company doesn't kick it back. You are not seeing me for a fee. You're seeing me for a monthly fee, but your visit fee is not a separate charge.
It's included.
It's included.
And so, because I have a membership to this.
Okay.
And for me, on the other side of the table, it was, and people asked me, like, wait a minute, why are you paying $150 a month? You can just go see a doctor. I'm like, well, okay, but they have copays and stuff. I was like, okay, you don't understand the difference. The difference is experientially, it was a more dignified experience where I go to a doctor and I respect my time. I go to a doctor, I have a 2:00 appointment. Oftentimes I'm not seen until 2:30. I have to go park. I have to go do some intricate place. I got to go find, and then I got to wait. I got to hurry up and wait 30 plus minutes. Then I see a nurse who asks me a bunch of questions. She's in a rush. She's seeing a million people. Then I got to wait more, sometimes up to 20 minutes. And then I get to see the doctor. And then they're in a big rush. With the model that you're teaching, it's a polar opposite. I have a 2:00 appointment. First of all, I drive right there, park, we walk right in. At 2:00 sharp, who's there to greet me? My doctor or my provider. And handshake, provide, sit down, and she's the one doing everything. There's no, you're just seeing her, and she's in no rush, and she's taking her time answering all my questions. Totally relaxed experience, as opposed to what I'm seeing the traditional provider. It's almost like I feel like bad, like I'm a burden. I almost feel like, okay, so you're really busy, so I don't know, maybe I shouldn't mention everything that's wrong with me. And it's like it's frankly a very anxious experience, and it's a very frankly, this is kind of harsh language, but for me, it's kind of a disgusting experience because I see as a business person, I see y'all. This is just a big money thing. Like y'all just trying to pack in as many people to see, make as much money as you can. You don't really care about what's going on with me, and I can tell because when I say things, you're emotionally like deaf to it. You're dumb. You're not flickering. You don't really care because you got 18 other patients you got to see, and you're already 18 patients behind.
Right.
Where when I'm doing in your model, it's the polar opposite, and I feel like, wow. This is actually a relationship where someone cares, knows my health, knows me, cares about my health, knows my family.
Right. can name off your
I can
kids.
name off my kids. And I'm just like, dude, this is like infinitely better. I will never step foot in another provider's. I will never go back to that. It's a lot like I just recently got an electric car. And I don't know, I love it. I don't, I love it because I'm a little sensitive to sound as well.
Mhm.
So it's quiet. I never have to go to the gas station. There's no oil changes. I don't think I'm ever going back to regular cars.
Right.
Similarly, I will never go back to it. It is a far better model.
Oh.
Is that your experience with the patients that you've had?
Oh, 100%. My patients greet me. I hug them.
Yeah.
I know they're happy to see me. I mean, this
Yes.
is a model where
Yes.
people are happy to go to the doctor.
Yeah.
And I'm happy to see them because when I see them, I'm like, "Hey, are you feeling better?" And their answer is yes. Right? We're approaching healthcare incredibly differently. It actually changes the mindset of your patients too. When they're checking in often, they're
Yeah.
checking in before they feel horrible, right? They're checking in because they're not hesitant to contact you. They're
Yeah.
like, "Hey, something's not quite right?" So they're making their appointments with you ahead of time. They're being proactive, which gives them a lot of autonomy in their own healthcare. Are you eating right? Are you doing things? Are you taking care of your stress? Are you sleeping right? These are not things that we talk about in primary care setting. In primary care setting, you're like, "Here's your managed hypertension, here's your refills, what else do you need?"
Yeah.
Right?
Yeah.
So this
On the
is
way out.
on the way out,
Yeah.
and
Yeah.
I'm in a hurry.
Yeah.
And if you
Yeah.
think about it, even the way it's set up, the way my clinic is set up is that I have an office. My patient comes into my space.
Yeah.
In my office, they see pictures of me and my kids on the
Yeah.
wall.
Yeah.
In a traditional healthcare setting, you're in rooms like cattle,
Yeah.
and the doctor has to move in and out.
Yeah.
That's how fast
Yeah.
a doctor has to see patients
Oh,
because
that's another thing I forgot. You're in this waiting room with
you're
all these like really terrible, depressed looking people.
direct primary care clinics have small waiting rooms, privatized offices.
Yeah.
You're looking at 30-minute to an hour visit.
Yes.
You're getting the time and you're leaving with a treatment plan that is obtainable and a follow-up plan.
That's one thing I really liked is the flexibility of it because like I recently, because I fly a lot. And so
Mhm.
my ears were just off. Like, so I'm like, I think
Oh, yeah.
something's wrong with my ears. She looked at my ears and she's like, You're fine. It's in your head." I was like, "Okay." And we were done pretty quick. And then she's like, and then she said, "How's everything else going?" And I'm being kind of funny, but I was like, I started complaining about my wife and kids. 40 minutes goes by and she's sitting there. We're talking for 40 minutes. And for me, she's not a therapist, but it was very therapeutic for me. Everyone has complaints about their family, right? So it's like I was just getting all of it off my chest. And I felt great after I left, just getting, but she sat there the whole time, very happily listening, contributing. And it was just,
Oh,
she
don't call
cared.
my patients, but we gossip about so much stuff. But I feel like that's
Like
part of the
friends.
experience that you should
Yeah.
have because this is the person you're going to come to when personal things go misaligned.
Yeah.
I do hormone therapy, so sex is on the table for
Yeah.
discussion. And if you don't have a relationship with your provider where you're talking about hormone balance, weight loss, eating disorders, traumatic events, what's keeping you up at night,
Yeah.
stress, like this is the person that is supposed to be taking care of your whole health. So if they don't know that you can't sleep at night and what's keeping you up, how are they supposed to help you?
Yeah. I'm a business guy. So when you talk about this model, me knowing the traditional medical system, and you say, hey, well, first of all, let's identify something real quick. Who are the people that can really switch? Well, okay, a couple of things we need to talk about. There's so much to talk about.
So much.
The first thing I'll say is this. When you say, hey, RNs, and what are all the people that this model, it'd be suitable for them to switch? It'd be RNs.
No, so RNs aren't providers, so we have to keep it.
Okay.
An entrepreneur can own this company.
An entrepreneur can own this
An
company.
entrepreneur can own this company in most states with an MSO.
Okay.
Sometimes you have to partner in certain states with a medical provider according to those state license for a portion of percent ownership.
Okay. And you help with that.
And yeah.
Okay.
And so it just depends on the state. Then once you have the ownership established, if it's an MSO model, they basically hold all the rights to the patient information.
Right.
So then you're just hiring a provider. But if it's provider owned, the financials look a little bit different because you're not out a provider salary.
Right.
But primary care providers typically make around $250,000 a year. If you own this medical model with a smaller overhead and you're charging $150 a patient, you don't need as large of a patient panel to make the same paycheck. So on a traditional healthcare model, every doctor typically has anywhere between 2,000 and 5,000 people on their schedule, like on their patient panel. I mean, if you do the math on that, that's
Yeah.
5-minute visits for everyone and 40 visits a day
Yeah.
or something ridiculous like that just to see everyone in your patient
So,
panel.
so who's a good match to switch to doing this more private practice?
So DOs, MDs, PAs, NPs. They're
Okay.
all prescribing
Say that again.
providers. Sorry.
Yeah.
DOs and
DOs.
MDs, which are both our doctors that
Yes,
we know
yeah.
are medical licensed doctors. Nurse practitioners and PAs, considered advanced practice professionals.
Okay.
NPs have different rules than PAs,
Okay.
but all are prescribing licensed providers
Okay.
in
So
the United
all
States.
of these are qualified and can do this model that you're speaking, the direct patient care model, correct?
Yes.
Okay. So now, as a businessman, I look at that and say, well, Dr. Courtney, I confused because you're saying they can make more money
Mhm.
and their CP and their hours are less, 8 to 5, 9 to 5, and they're seeing each patient for a half hour to an hour.
Right.
The math ain't mathing. So
Right.
how does that work?
Right. If you're a numbers guy, you're starting to figure out where the middleman in the traditional model is.
Right. Exactly.
So I don't know how to not bore you with the nuances of traditional billing.
Yeah.
So when in the traditional setting, you see a patient, you bill the insurance company according to a code.
Uh-huh.
Okay. So if I see you for a really complicated healthcare problem,
Right.
the numbers are crazy, but we'll simplify it for this conversation.
Yeah.
I'm going to bill you at a level 5.
Yeah.
If I see you for a runny nose, you're getting billed at a level 1.
Right.
Make sense?
Right.
So the more I upcode your visit,
Right.
the more the
Sounds like a
insurance
nightmare. Yeah.
will reimburse me.
Yeah.
That's how the traditional healthcare makes sense. So that's why when you go into a traditional healthcare, they have all those forms. Are you suicidal? Are you this? Are you that? Right? Because the
But the
more
provider's not making that money.
no, the provider's not making that money. They're just the
The
facilitator.
ownership of the hospitals and all that, they're
Yes.
the ones making the real money.
Yep.
And so now this is an opportunity for the providers to take
Can-
control, make a lot more and work a lot less, and actually enjoy what they do in a more humane environment.
Right.
Okay.
Because now there's no middleman to pay. The
Beautiful.
requirement, there's no extra billing. Like I don't
Yeah.
spend hours charting after work to make sure all of my codes
Oh,
are
gosh.
in line.
Yeah.
I see my patient. I put codes in because some patients do like to get reimbursed for their insurance. So
Right.
in this model, you create a legal medical code. You still have to uphold the standards of your license. Provide a
Right.
medical bill, show accurate documentation that you provided correct medical treatment.
Yeah.
That doesn't go away. The experience changes though.
Yeah.
And so at $150 a month, you're paying for the access to somebody that's going to treat you like a human and provide care.
Yeah.
And it's really affordable
Yeah.
in that aspect of it. And some people say, well, I don't see my doctor every month. But
Yeah.
you know what? The time it saves you that urgent care visit, 6 hours of your life, because you didn't have to go to urgent care because your kid had strep throat, then go back to urgent care and get a return to school notice.
Yeah.
That's a friend just told me she took her kid to a urgent care because they sent home from a fever.
Yeah.
They have to have a doctor's note.
Yeah.
So $250 for her to take her kid to urgent care
Yeah.
to say he has a fever. Okay,
Yeah.
well, she knew that.
Yeah.
And then to get him back to school, she had to go back to the urgent care, $250
Yeah.
to say that he doesn't have a fever. So $500 that would have paid for
it's one big like almost circus. He said, she said, go there, go here, come back here, referral this,
Yeah.
It's just, and it's like a ping pong machine. It's like what's that arcade with the pinball? It's like a
Pinball.
pinball
It's
machine,
pinball.
and we're the pinball.
Yeah.
Go to this, get a referral here, go there, go to the insurance. Well, the insurance said come here, and we're just the ball bouncing around.
And the great thing about direct primary care, if you have a full practice primary care, I can do anything from remove a wart, do stitches, hormone therapy, weight loss therapy. It's one place and somebody that knows everything about you.
Now you said weight loss therapy.
Mm-hmm.
You have a very impressive background. You were in the Marine Corps.
I was.
Tell us about that and how that led
So
to you helping people with weight loss.
ironically, I didn't ever think it was anything that I did in the Marine Corps, I did not expect to show up in primary care. So I was
it's two different things.
Yes, I was 17 years old. I joined the Marine Corps. I wanted to be a Marine. Like this is what I thought I was going to do for the rest of my life.
Yeah. What made you feel that way?
I grew up being a tomboy. This
Yeah.
is just, I mean, I'd have to probably ask my mom for some
just
better, clear
attracted you,
insight.
yeah.
I mean, I wanted to do it. I mean, I think G.I. Jane might have come out sometime.
Right. Yes.
Right?
Yes. Demi
I mean,
Moore,
this was the person I resonated with. This was,
Oh, wow.
so,
That's
I mean,
wild.
this is what I was a helicopter crew chief. I worked on 53s. I'm the in-flight mechanic.
Oh, cool.
So
Wow.
nothing that translates to medicine.
Yes.
But something had happened to me in the Marine Corps, and I handled it poorly. I guess not poorly, but the way somebody with a traumatic event could handle things. And I ended up with a severe eating disorder.
Oh.
I was 20 years old.
Yeah.
And
But you were there for years.
I did 3.
Okay.
And then what happened is because I worked on helicopters, when you go under your 100-pound limit, none of the equipment is there safe for you anymore.
Oh, wow.
So I'm a small person in general, and I'm 115 pounds now. But when I lost my flight status, I was 83 pounds.
Wow.
So I couldn't safely operate a helicopter at the time, or even be a crew on one. And as eating disorders do, they sort of mess with you a little bit psychologically.
Yeah.
So I have to kind of front face that. And I went through life, figured it out, solved my own problems after I got out. Lots of therapy, food relationship problems, self-help books is embarrassing. Don't look at my Audible files.
Oh, I got all of them.
So I didn't ever think that I would find a significant use for that. I was like, oh, well, that was my struggle. But in my clinic, I do weight loss management as part of a service that I provide.
Yes.
Weight loss management is a relationship with food, whether you have a relationship with food being anorexic or you have a relationship with food and obesity. It's all just tied to how you see food.
Yeah.
And so here I am teaching women or men, teaching people about food relationships. And I'm finding that everything that I have learned about myself, I'm helping other people with. And I didn't expect to see that come up. But most people's food relationships are trauma of some kind or another.
Yes.
And food dependency, and even small things that we don't perceive as trauma. When you scratch your knee, what do your kid falls down, what do you do? Take him for ice cream or get him a lollipop, right? Here, feel better.
Yeah.
Right?
Oh, wow.
And America's big about that.
Yeah.
We have a huge obesity crisis.
Yeah. Oh, yeah.
And our food it's all around us. And food's a social activity. Right? What do? You can hang out with your friends. What do? You're going to go eat.
Yeah. Yeah.
So now you're on this massive journey to maybe lose weight, because even if you gain a pound a month every year, that's 10 pounds. It doesn't take long before you're 100 pounds overweight.
Oh, wow.
I mean, that's all it is. 100 calories.
Like that.
100 calories a day, which is eating 3 Hershey Kisses.
Oh, gosh.
That's 100 calories extra every day.
This is depressing.
It's a little bit, sorry. Podcast took a spin. You're going to gain a pound a month. At the end of a year, you're going to have 12 pounds of weight gain if you don't balance your life.
Yeah, incredible.
5 years, you've gained 50 pounds. It's just not that hard.
Yeah. And I actually love that, because it's just on the flip side of that, is you just make these little changes.
Little changes.
Like if you had an ice cream every day after dinner, well, if you stop that and just that, nothing else,
it'll reverse. But nobody wants to lose 50 pounds in 5 years, right? You go on a weight loss plan, you want someone to help you get there quicker, faster, healthier. Once we make decisions, we want rapid results.
Yeah.
And so I didn't actually expect seeing myself in this space, but I do.
Yeah.
And I find that people really appreciate. I feel like I'm a very fit person now, and I've really managed my food relationships.
Yeah.
And when somebody's sitting across from me and maybe they're not there yet, and I look at them and they say, oh, well, I'm not like you. And I'm like, oh, but you are, because I'm like you.
Yeah.
I didn't have a healthy relationship with food. I was sitting in that seat.
Right.
And
they probably get shocked when you tell them that.
They do, because I don't think people know that a food relationship is the same whether you overeat or undereat. It's the same mechanism of inappropriate relationship. And so I think
I probably overeat.
I mean, all of us do. It's really easy to do. You have to be consciously aware to not.
Yeah.
And so I do. I find that people really love that but they wouldn't know that about their doctor. Prior to having direct primary care yourself, what did you know about your doctor?
I didn't even know my doctor's name properly.
And now my patients, for the most part, a lot of them know this about me.
Yeah.
We've
actually become family friends. My daughter was at their house last night playing with their kids, and you actually kind of become friends.
And I think one of the things that providers get a little bit scared about, is leaving the security of a system.
The golden handcuffs.
They leave that security, and now they have to do a little bit more entrepreneur, which is not what they were taught in medical school.
I wanted to ask you about that, because a lot of doctors or providers are not necessarily, meaning What do you say to the ones who are feeling like, well, dude, I don't know if I really know how to run my own thing?
So one of the reasons I built my program is that because a lot of people just don't know how. I happen to grow up in a family of entrepreneurs.
Okay.
My parents owned 7-Eleven stores when I was a kid. They owned a restaurant a little bit later in life. My parents have always had their own businesses.
Okay.
So to know a little bit about what a startup looks like, right?
Yeah.
To what being owned by your business looks like.
Yeah.
I've owned a few businesses other than healthcare outside of that. So for me, it doesn't seem to be a challenge. So I take that challenge away from people and help them through it.
So if I'm getting this right, providers who are kind of burnt out, bugged out, maybe it's affecting, and we'll talk more about this, but maybe it's affecting other areas of their life. It's just that it's not really what they thought it'd be. They're sick of it. You have another model, the direct care patient model, and they might be like, well, dude, that sounds awesome, but I mean, like, I don't know how to start that. Where do I get a place? How do I get clients? How do I do this? And how do I do that? Your program holds them by the hand.
Absolutely.
And walks them step by step through each one of these. Okay, first thing, let's get the paperwork done. Okay, let's get the place. Might even be a televisit place. Might be a little office. Okay, now let's get you clients. Okay, now let's show you how to do the fulfillment. And so from A to Z, you're with them from conception to actually having clients, being profitable and confident and happier. And you're their guide
and the great
mentor.
Thing is, I lived that space.
Yeah.
So I not only do I know the patient process, but I know where it's going to bottleneck.
Yeah.
And so by my business being successful, I wish somebody would have been like, here, just do this.
Yeah.
And so I built that.
Yeah.
That's what I would have wanted.
Because your practice is exceptionally well.
I feel like my practice does exceptionally well, yes.
Yeah. Yeah.
I'm proud of what I built. I'm proud of the speed in which I built it, and I'm proud of the patient care that I deliver.
Yeah. I mean, I won't share the numbers live here, but I was pretty extraordinarily impressed. Yeah, they're very impressive numbers.
Thank you.
But for me, it's like I consider myself and yourself, frankly, humanitarians, where it's about saving these providers, because not only is it like corrupt and they're overworked and they're burnt out, but because of that, there's a massive ripple effect, such as it leaking into their relationships and things of that. Can you talk a little bit, kind of expose that kind of side for us?
Yeah. I think that, we hear a lot of what the patient experience is.
Right.
You can get on social media and somebody is going to be venting or trying to talk about their healthcare experience where they're unhappy. I mean, I could get into a room and say, who's had a healthcare experience that they're not a fan of? I don't think anybody doesn't raise their hand. But if you turn around and ask, I don't think people know how unhappy providers are.
Right.
I think if you turn around in the same room and ask a room full of doctors, are you happy going to work?
Yeah. No.
You don't get a hand raised.
They're not happy.
They're not happy. They're emotionally burnt out. If you look at a primary care, and they take the brunt of a lot of stuff, right? They're not available because they're super stacked. You can't get in to see your primary care for 2 months. They don't specialize, so you have to get referrals. So they get the brunt of this anger and frustration with the healthcare system. And then the other place that gets it is the emergency room, because when you can't get to your provider, where do you go, right? If you end up with a urinary tract infection that your provider could have handled if they could have seen you, that's antibiotics and go home.
Yeah, it's not a big deal.
But if you can't get in, where do you go? So the emergency...
That happens a lot too, by the way. With my direct primary, it's like it's anytime. With the doctor, sometimes, hey, come next week. I'm like, next week? I need somebody now.
Right.
And then I do have to end up going to urgent care. Which is a whole nother nightmare.
So,
I forgot about that. That's a very good point.
Yeah. Well, and so having worked personally in the emergency room, we think from providers in the emergency room that the title says what it is. It's an emergency.
Yeah.
So we have an expectation that things are emergent, and when you get into the ER and people are coming in for regular health concerns, you start to build this underlying frustration. And then you're sharing it with your colleagues. So now it just becomes a day that everyone's irritated already. And then you're seeing a significant amount of people and you go home with that attitude.
Yeah.
and you're already burnt out. And maybe you did need compassion at work. Maybe you did need to be very present for somebody at work. So somebody's having the worst day of their life. They needed their doctor. God forbid they lost somebody, or they were injured to a point that they have it right. So you still have to show up for these patients. And you get home and you're like, oh, I'm exhausted. I got thrown up on today. I got peed on today. I had to do CPR on a child today. And then I also had to see a runny nose. And then you get home and your daughter wants help with her homework.
She just wants a hug. Yeah.
And you're like, no, I can't do 4 + 4 for you right now. Don't you have 4 pennies to count?
Yeah.
And
someone died in my arms today. I'm not interested in doing 4 + 4 right now.
And then you bring that home to your kids who want their mom, and a husband who wants their wife. And you have nothing to give.
Wow. So that's why it's great that they get to work less and make more money, yes. But that's why I really love your model. It's because I feel like it's bringing them back to a higher quality life where they're actually a better husband or wife or father or mother. And for me, that's everything. That's so much more important than business. Yeah. For me, it's always been like God first, family second, business third. And you can't, you give people time to do things that are there's other things besides working that people want to do, whether it's giving back, or whether it's just fishing, or whether it's just just being with your family and being present. Yeah, exactly. And so that's why I feel like you're giving these practitioners their life back.
I really think so. And I have friends that are still in the emergency room, and some radiologists and a few others. And I'm going to tell you, the best compliment I ever get is when a doctor sends me his family, right? Yeah. So when I have a doctor that comes to me and is like, hey, I need you to be my provider. Yeah. I mean, typically providers have this unspoken, we sidebar each other, right? Right. You just provide services for each other. It's an unspoken professional courtesy. Yeah. So when a provider comes to me and signs up himself and his family to be in this model, that's the biggest compliment you could give me, is that they are in the healthcare system and they know it doesn't work. Right. And so they're like, I'm going to send the people I love the most to go see me.
That just doesn't say it all.
And take care of them in a direct primary care setting. If the people that run the show know it's not the right show.
Yeah, if that just says it all. It's kind of like, like Zuckerberg and these guys who owns Facebook, he doesn't allow his kids to go on social media. Right. And it's basically just saying that, hey, they don't want their family involved in this cryptic system. Yeah. They want a more natural, God, even just talking about it, I feel like lighter, just like the more traditional, holistic, natural, because they've basically bastardized the system. They've basically turned it into this cash cow. They've just completely turned it into this capitalistic, cash cow.
And originally it was meant to enhance human connection. Yeah. Right? Like that was actually the point of social media originally. Learn, have a little more human connection. Reach out to people that you otherwise wouldn't meet and otherwise wouldn't see and spend time with. Yeah. And we lost all that. Yeah. And I think healthcare did the same thing. Originally, the person that came with insurance only meant good, right? Put all the money into one fund so that everybody can have affordable healthcare. Yeah. That was the original plan.
Religions were doing it. Christians were having their own and different religions.
Christian Ministries is a health share account. CrowdShare is a health share account. Yeah. It's not an unknown concept, and it's not even a bad concept.
So they're making, gosh, I'm just thinking from the provider point of view, they're probably thinking, well, dude, how much is it going to cost me to start my own? Because they probably have these ideas of people spending millions of dollars to set up stuff. But if I'm a practitioner, and I want to start this, I'm like, you know what? I'm sold. I want to start. I've heard about this direct care model. I want to go there. I want you to help me. The actual setup
is not expensive. Setting up.
I think that's shocking for a lot of people.
I think it is. It's not expensive to file paperwork to start a business. How many businesses have you started? Couple $1,000 to file the infrastructure for it. Yeah. You have to do the work. You have to pay a lawyer maybe. You have a couple of professional fees.
So nothing to talk about the setting up the paperwork, but then what about actually getting the facility and like all that sort of stuff?
There's so many ways around this now. So health suites offer, office sharing suites now. Because you're
that's
not,
where I go. Yeah.
Because you're not seeing patients where you have to have this massive waiting room in this big facility.
Yeah.
This model is easy to start.
Yeah.
So all you need is a contract with a local health share suite. Or I do have some of my clients have started a telemedicine business.
Right.
People really do like being seen in person.
Yeah.
I wish I could remember the name of, there's a physician, and he talked about how important the physical exam was.
Yeah.
And now we have all kinds of machines. Right?
Yeah.
It's hard pressed when you go in to see your doctor that I need to listen to your heart and lungs if you don't have a heart and lung complaint.
Right, yeah.
But his story was how important it was to put your hands on a patient and to feel like you were present with them. And so I think still in the direct primary care model, it's really important to have a place where you can sit down with your patients and see them.
So AI is going to replace everything except for the exchange of human energy.
Yeah, well.
So let me ask you this, head to toe, from business licensing to getting a place to some marketing and just everything from fruition to actually I have a clinic, I got clients, we're making money. How much will that cost? Range.
How about this? How about I tell you how much I spent on mine?
Yeah, great.
$10,000.
Wow. I don't believe you.
So $10,000 is what I spent. I started I have a little bit of I had some connections in construction. So I actually have my own private practice, like in a building. I don't own the building, but I have a rented space. That's my own clinic. So I had renovations. But had I not had renovations, it would have made sense. I'd still only spent $10,000.
With renovations?
With renovations.
Wow.
Some paint, some flooring, clinic. Now,
wow.
I started with yard cell medical exam beds. So I mean, we weren't talking about glorious. And it's funny, actually. I saw one of my patients that have been with me from the beginning of my clinic.
Yeah.
And she made some comment when she walked into my office the other day. Because now I have a nice desk and a professional med bed and some chairs that they can sit on. And she's like, I remember when I came in here on a milk crate.
Wow. So 5 to 25 in that world.
Yeah. I mean, you really don't need that. If you want to start one for $100,000 and you want to build out a bougie clinic, you definitely can, but you just don't need it.
Wow. And so you kind of really bootstrapped this $10,000, which included renovations and licensing and the place and everything. And then you kind of organically upgraded the furniture, upgraded everything. But because of the model.
It's very organic, so good word.
That's kind of your marketing strategy too, isn't it?
It is.
Because I'm sure that's a big question on people's minds. Like, okay, cool. I can.
How much do you have to spend on Google ads?
Well, how do I get, so to make, let's just do rough math. I mean, to make $500,000 a year, how many patients do they need?
$500,000, you're looking at less than 300 patients a year.
Wow. So how do they get, and that they're still working within their roughly 9 to 5 confine. How does one get 300 clients?
So I tell people you start with 10. You start with 10 amazing patient transformations. You get 10 in your first month.
Yeah.
Every one of those is going to send you somebody.
Well, that's pretty remarkable.
I mean, if you give them the patient
that's true. I send a lot of people.
One. You just need them to send you one.
Then it's such a great experience.
How many do you have next month? That's 20.
Wow.
And then if every one of those sends you one, you have 40. So if you continue the patient experience, it's not, because this doesn't have to be a numbers game.
Well, it's very funny you say that. They say the best way to market something, the absolute number one best way to market something in the world is to just have a great product.
Just have a great product.
And it'll market itself.
It will. It really will. Wow. I can't tell you. And the age demographic of people that typically are attracted to this model, probably 30s to 60s.
Yep.
Pretty soon Medicare, they start seeing that.
Yep.
But I think the great thing is that this is a younger population, 30 to 40. They are proactively looking at their health for longevity because they don't want to be maybe their parents or their grandparents.
Right.
They
don't want that to define.
That had a lot of polypharmacy. How many, walking around with pill boxes. When people come to me, and I do take a lot of patients that want maybe an exit strategy from the traditional healthcare system. So they'll come to me with 10 medications and they'll say, my doctor won't help me get off these. And I'm like, well, what do you take this for? 9 times out of 10, they have no idea. 9 times.
The doctor says jump, they say how high.
And a lot of medication has multiple uses. So I'll look at a medication and I'll be like, what do you take this for?
Yeah.
I don't know. Like, well, it has multiple uses. Do you take it for do you take it for sleep? Do you take it for depression? Do you take it for, I usually have to roll through 3 or 4 different, they go, oh, that one. That's what I take it for.
Oh, wow.
I'm like, oh, okay.
Good to know.
Good. Is it working for you? Oh, no, I still can't sleep.
Oh, wow.
Okay, perfect. So if this medicine is not working for you,
maybe not take it.
how about weaning off it?
Right.
And here's the great thing is that when you start that is exactly what this model does, because I'm going to meet with them every month and it's not going to cost them anything. But as we change their approach to their healthcare, they're meeting with me every month and they're getting this consistent guidance on when is their doctor ever going to do that with them in the traditional setting.
Do you have any kind of clients that you teach people how to set these up from head to toe? And by the way, what's the time frame?
So my course specifically runs 12 weeks.
You're kidding me. So you're telling me if I make a decision today.
Today.
And by the way, this is not just for practitioners, but this model can also be done through entrepreneurs.
Can.
So like someone like me who has zero medical background.
Correct.
I can actually open one of these. And you're telling me that either me as an entrepreneur or a medical practitioner from day one that, you know what, I just met you, Dr. Courtney. I love it. This is incredible. This is what I've been looking for. I'm into it. Yes. That's day one. You're telling me 12 weeks later, they're going to be up and running with patients.
I'm going to tell you that 4 weeks later, most of my clients have taken on their first patient.
My good God.
So
4 weeks.
4 weeks.
Your entire life's going to start changing.
Right. So the first week is infrastructure.
Wow.
The second week is setting up what we call in medicine an EMR, electronic medical health record.
Yeah.
The third week is setting up your vendors.
Yes.
Why can't you take a patient on that 4th week?
I can't help myself from smiling.
Right.
Because you're talking about they're going from like, okay, it took me 10 years to become a doctor to like, hey, 4 weeks, we're going to totally change everything.
4 weeks, I can change your life. Now.
Wow. Give or take.
You have to work at it. Now you have to do something that you're not used to doing in medicine. Now you have to create a little bit of a presence. You have to let your patients know who you are.
Right.
Social media, unfortunately, is a big thing, but it's free marketing.
Do some of your clients partner, like they have a family member or a friend or something who's a little bit more like business savvy than them and they kind of partner together and do this practice together?
I love it when they do that. I love it if you have somebody who, if I say the word marketing or funnel, they're like, I don't know what that means, but John does.
Right.
I like it when I say, okay, we have to talk about KPIs, and they look at me like, is that a medicine? I'm like, no, it's not. Okay, where's your brother? Get him back on this phone call.
Bring your brother back, yeah.
I'll walk you through the functional medicine protocol because in my course, I teach some 4 basic things of functional medicine, which is overlooked highly in medicine. If you ask a doctor how many nutrition courses they had in medical school, it's actually 0.
Pathetic.
What is the primary drive of functional living?
Nutrition. It's 90% of it, some say.
How come your doctor doesn't know what foods you can eat to have vitamin D?
Because there's no money in it, that's why.
There's no money in telling someone you have to eat wild-caught salmon that eat phytoplankton for vitamin Z to get your own vitamin D, right? That's a fun nuance that...
But you tell your patients.
But I tell my patients that. And I say if you can't get there... I think I did... I might have posted something on social media. Do you know how many servings of salmon you have to get to eat the daily requirement of vitamin D?
Gosh, I didn't even know. I'll be very frank with you. I didn't even know salmon had vitamin D.
Well, they are one of the fish that eat the bugs that get the sunlight.
Oh, wow.
So this is how you get vitamin D. 10 servings of fish a day.
You have to have 10 servings of fish a day to get the sufficient amount of vitamin D?
No one's going to do that. And here's the other part.
No.
That's only if you eat wild-caught salmon.
Right.
Okay, where is our grocery store salmon from?
Yeah, farmed.
Farmed.
Yeah.
Do they have sunlight? No. And what are they fed?
Farm food.
Right. So it just goes to show you that nutrition has taken its toll. And if you look at America, it's very clear.
Do you know what some doctors have told me? This is where I'm just like, you guys are nuts. You know what they told me? I'm starting talking about vitamins.
Mm-hmm.
Like, there's reports actually that vitamins cause cancer. I said, do you not see what's happening here? like some of the healthiest people in the world that I know, you just look at someone, you can tell. I mean, are you a fan of supplements?
I am a fan of supplements because there's no way that I could eat what I need to eat in a day I'm not eating the carrot grown out of my grandmother's backyard that was fertilized with the cow that she also grew in her backyard, right? That's just not what I'm doing. I'm on the run like everybody else. I'm grabbing a salad and go at a fast food restaurant if I have to pick one. I'm trying to meal prep, but let's be real, none of us do. I want to really bad.
Yeah, me too.
I actually have a meal prep company that I have learned that has been worth its weight in gold in my life.
Oh, wow.
And they're $10 a meal, and I order 5 every week.
Yes. Yes.
That's worth it to me. $50 a week is worth the difference between me having a healthy meal and picking up fast food.
Yeah.
So yes, I supplement. I think that was the original question.
Yeah. No, that's so. I mean, I'm just in shock. I think this is very eye-opening to providers that, hey, let's just say give or take 12 weeks, give or take 10, 15, 20, or whatever it is, you're getting your life back, and it's real. Yeah. And people are doing this all over America, correct? And basically this works in pretty much every state.
Yes. You can have a direct primary care in every state. The legal structure is confined to who owns it.
Yeah. And again, I'm just thinking about all the things because I love everything, but I just want to get a holistic picture. Liabilities. Mm-hmm. How does that work? Because, that might scare some people.
You still have your medical license and are required to carry medical malpractice just like you would if you worked for anything else.
Now, you're not under any extra liability.
No extra liability. As a matter of fact, your medical malpractice in a primary care setting is actually one of the lower medical malpractice you could pay it depends on it's the level of procedures that you do is how malpractice is kind of defined. So take an OBGYN. If you mess up that procedure, you have messed up somebody's life for 18 years. That's why OBGYN insurance is really awful.
Yeah, that's depressing.
That is depressing and stressful. And you can see why OBGYNs are, terrified, why they cost so much, why insurance is definitely a mandatory thing for them, why working for hospitals is a mandatory thing for them. They have to have so each field has its nuances. Yeah. But in this setting, we're talking about primary care. We're talking about things that you would take. I am still going to tell my patient to go to the emergency room when it's appropriate for them to go to the emergency room.
Yeah.
I'm not taking out a spleen in primary care. So if you get in a car accident, guess where you're going? Emergency room.
Well, your primary care business does exceptionally well.
I think so.
Why? Why then do you have a separate business of helping to try to save these other practitioners? Be like, dude, there's a way better life. Come on down over here.
So it's multifaceted. One's a little bit of a personality structure for me. I love helping patients, and I love that, but I love to create and build. I'm an entrepreneur at heart. It's kind of a family joke that I do something for about 5 years before I pivot.
Right.
And I think for most people that like to build and create, I think I'm right on par. I think I'm right on par with my colleagues that like to do that.
Yeah, it's extremely normal.
So that is that. I think I can actually help more people teaching people how to do this.
Oh, the ripple effect.
You're
getting not only you're helping save all these doctors' lives, but you're actually helping all those patients that they're getting have a much better form of care.
I grew up in a small town. I watched my parents succeed wonderfully well financially.
That's right. Your practice does really well in a very small town.
Very small town. We have population about 5,000.
That's wild.
And when I did my market analysis to build this business, it was not supposed to succeed. I don't even know why I did it in the first place because I looked at it and went, that's fine. We're going to ignore that.
It was a good idea. Yeah.
We're going to do this regardless of what the paperwork says. But it does. The median income in my small town is $60,000.
Yeah.
That's poverty level in the majority of America. You can't live off that anymore.
No.
But you can talk to people about what they're willing to spend money on. Yeah. And you can either spend money on your Starbucks coffee every day, or for less than that, you can spend money on your health.
Yeah.
It's less than $5 a day. It's less than a cup of coffee.
Yeah.
To have access to primary care so that you can take care of things. And I said, if you have an emergency, I'm going to send you to the emergency room. But I might be able to save you that emergency room trip by just telling you, this is actually not an emergency and we can handle it this way.
Yeah. I really relate to this because I've actually always been this way my whole life. I used to wholesale cars. I figured out a really cool way to wholesale cars from auctions and stuff. And then we had a friend who was a cashier, which is where I used to be a cashier. What he would make in a week I'd make in like an hour messing around. And so I told him, like, bro, I find a much better way. Come with me. And I taught him all the secrets on how to do the whole wholesaling bit A to Z. And like you have done many other businesses, and it's always been the same thing. Anytime I find a winner, I always tell the people, like, bro, that's terrible. This is a much better way. Come here, I'll show you how to do it. And so I think people are either liked it or they're not. There's some people who like when they strike something, and I have some people in my life that are like this. When they strike gold,
they don't want to share.
They're not going to tell you a word. But there's some people naturally that's just how their heart is. They just want to. I found it. Now it's like I want to help you as well. I'm benefiting, and I want you to as well.
I think that's a growth thing because I wouldn't give myself the credit that I was that way my whole life.
Yeah.
And you had to. Sometimes you have to feel a little pain before you're like, I don't want anyone to feel this way.
Yeah.
And that's unfortunate as humans. That's a human experience, right? It's the unteachable lesson, right? And but there's people that say, oh, competition is good for the soul. But it's really not. I mean, I actually really love your slogan. Make more to give more.
Yeah.
But it really is true. The more you give, the more you get. And you don't even have to enter it with that mindset. But the reason I ended up in like the hormone space was because I couldn't get help. And when I found help,
that's right.
I was like, I had to teach myself.
Yeah.
This was, part of my journey into this space was learning hormones. Yeah. And when I'm 46, and so this hit me really hard with stress and night shifts and emergency.
Yeah, that's another thing, right? When you say you're 46, and I'm like, well, you can easily pull up for your 30s.
Oh, God bless you.
And you know what I say? That's the person I want to be learning health from. Because I see other doctors, they look like crap, all due respect. I'm just being honest. And I'm like, I look at you, you're radiant, your energy, you're very healthy. I'm like, this is the person I want to talk to health with about. And I take a look at the tradition, and they're just beat up. Yeah. Do you know what I mean?
It really is. It's funny. I was kind of afraid to post about this trip that I'd just gone to Mexico with. I have some business coaches that have kind of helped me, move in the direction that I want to be. And I'm out there in the sun. I feel like I've worked really hard to be fit.
Yeah.
And I was like, oh no, you know what? I'm going to share this with my colleagues. You can live life like this.
Yeah.
And it's funny that you mentioned the doctors look like, maybe not the person that you.
Yeah, and I apologize.
No, that's fine because I wouldn't go to a hairstylist whose hair is not done.
That's what it is. I went to. Oh my God. This, I'm not being mean. I used to be very heavy. I went to this guy, and he was selling weight loss supplements, and the guy's like 500 pounds. I'm like,
do you take your own product?
Is there a camera somewhere? Like, I'm not quite. You know what I mean? I say this. I think that, like you said, most people have had a terrible medical experience. I have unfortunately a lot of family with cancer and things of that nature. And the reason I really love what you're doing, and the reason why I think that this is potentially one of the most important podcasts I've ever filmed, is because I'll never forget, and I don't have a great memory, but I'll never forget, I went to the hospital and I had a relative who was doing chemo, and she told me, she's like, you see this bag over here? It's like this little bag of chemo. She's like, that's $80,000. My insurance is paying $80,000 for it, something like that. And I look at the room, and it's like this big room of a bunch of these little bags, and and it's like a restaurant reservation where it revolves every few hours. So it's like you have all these rooms, 80, 80, 80, 80, and then every 3 hours it's a whole new batch, 80, 80. And that's from like, yeah, okay. I used to give them some privacy. When the nurse would come and want to do vitals or whatever, I would give some privacy. I went for a walk. I got a little lost. And I saw a picture of the doctors in their lounge or whatever. It was a painting of them. It was a picture of them. And there is a lot of ancient science to this. And I took a look at them. And one of them's got like this probably $80,000 necklace, diamond necklace on, and which I find very inappropriate in that setting. And I took a look at the picture of all the doctors there. And I swear to you, it seemed like a picture from hell. And I just saw, and I looked at their faces, I'm like, they just looked demonic. And I remember telling myself, I said, I bet you they didn't start off like this.
Well, and I bet you the doctors aren't even the ones making the money.
Yeah, no, it's this. It was that system.
It's the administration. Yeah. I mean, and it's not. I mean, it could be administration. It's this system. It's. Yeah. I actually have a really good friend he's dying to get out of oncology and into like a functional oncology, and he just can't do it. And the reason why is because he's so afraid of losing his medical license because chemotherapy is the only thing that is studied, right? Those are the people that make money, so they're going to pay for those studies. Yeah. So there's no studies that show a lot of evidence with high-dose vitamin C. No one's going to do that and create a study for it. So we don't have any studies for, unfortunately, people with cancer for an alternative route that doesn't involve somebody making a lot of money.
And I think that people, you can kind of see the before and after when people have kind of got into the system and they've just kind of turned into this totally different person, and you're saving them. And not only that, but you're saving, by you helping, let's just say 100 people set up their own clinics. Well, if each one of those 100 has 100, I mean, you're talking about thousands and thousands and thousands, which will very quickly end up to be a lot more lives that you've really, a lot of people get confused. They say somebody who donates, they're a philanthropist. Somebody who gives money, they're a philanthropist. Actually, the definition of someone who gives money is actually just a donor. The definition of a philanthropist is somebody who improves the quality of mankind. And I believe, even though you're a practitioner and you don't listen, I actually look at you as a philanthropist because you're really, they don't know that there's a way out, and you've provided a way out, and it's really, frankly, great humanitarian work, and I'm a big fan of what you do.
Well, thank you. I mean, I really think that the system.
Pause the podcast. Pause the podcast. Excuse me.
God bless you.
Thank you very much. It's actually peak allergy season in Dallas.
You need a Kenalog shot.
A what shot?
A Kenalog shot.
See, I've never even heard of that.
Oh,
and no, what is it?
It's a glucocorticosteroid. It's just a steroid. It takes your body's immune system down, so it stops attacking the allergens. Mm-hmm.
Wow.
But there is actually, your provider will know this. Ask her about Allergy Easy.
Allergy Easy.
Mm-hmm. Okay. It's immune suppressant drops. It's a 2-year course, and every 3 months you get a new exposure to an environment, and your body builds up a tolerance to it. I actually have 2 kids on it, and their mom swears by it, the fact that she's no longer like runny nosing, wiping nosy, booger snot kids.
Okay,
anyway,
I got to do that. So this has been a tremendous interview, and I think that I imagine that all the practitioners are going to share the heck out of this to help each other out, because they talk about this and with each other. Oh my God, I wish there was a better way. It is what it is. We're stuck. Da, 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 da. They're not stuck. There is a better way.
There is a better way.
And so if you had one thing, if you had one message, if you had one last opportunity to speak to these providers and tell them one thing, what would that be?
So I think we were chosen, if you really think about how you came into healthcare, you were chosen because you wanted to be a healer of some kind, usually. Usually, if you think back long enough, you can remember what triggered you to go to med school. It's a huge commitment. So something powerful made you join. So something, and maybe not. Maybe you're one of the few people whose parents said, this is what's for you. But if you're one of those people, then this is still what's for you, because you're going to make more money here and you're going to have a better quality of life. So if that's your only reason, make more money and have a better quality of life, that's for you.
Yeah.
But if you're somebody that actually was like, oh no, I used to be this person, you can help people still. You can love your job, and you can be financially more secure. And this model does it for you. This model serves all the purposes, and it goes almost back to an old model of healthcare.
Yeah.
And it's kind of nice.
Courtney, this has been a real honor for me to have you as a guest here. I am a big supporter of what you do, and I hope and pray this really saves a lot of lives, brings back people to a happier place, gives patients a better care, gives providers a better life, and gosh, what else could we ask for? Thank you so much, and let's do this again.